Hi, hello everyone, I'm your nursing student Brian, and for today's video, we are going to perform the physical assessment of the musculoskeletal. We are going to assess the lower and upper extremities of our client or patient. Without any further ado, let's start it. Prior to performing the procedure, we need first to introduce ourselves and verify our client's identity, okay? Hi ma'am, good afternoon. I will be your nursing student, Brian. May I know your name, please? Your birthday?
March 13, 1960.
So you're from Burawen, am I correct?
Yes.
Alright. So after identifying and verifying your client's identity, you need to perform hand hygiene, okay? In this procedure, this is to ensure yourself or prevent yourself from the transmission of any diseases, bacteria, or viruses. Okay? After performing hand hygiene, you need to provide clients privacy. Procedure is we need to inspect the upper extremities for overall skin coloration, texture, moisture, masses, and for lesion. Ma'am, I'm going to inspect your overall skin coloration. Would it be okay? Alright. Let's see if there is any redness, scars, or lesion, swelling. Okay, can I see over here? The other side. Okay. So based on my inspection, everything is normal in my client's upper extremities, okay? The skin color has no indication of cyanosis, pallor, or jaundice, and no swelling or redness observed. It has a soft texture and no masses and lesion observed. Next is we are going to test the cranial nerve 11, which is the spinal accessory, by performing the shoulder shrug and turning the head against resistance. Okay, ma'am, I'm going to touch you. Is it okay? I want you to shrug your shoulder for me. Another one, please. Another one, please. Alright. So now I want you to turn your head to your left. Okay, it's very strong. Another one, alright. Okay, so based on the performance of my client or based on the assessment, the cranial nerve 11 is well functioning and you have nothing to be worried about it, ma'am. So everything is fine and normal. Next is we are going to palpate the shoulder and arms for tenderness, swelling, and for the temperature, okay? Okay, let's say for the temperature. Alright. Ma'am, I'm going to touch you again. Is it okay?
Okay.
Let's see if there is any masses. Alright. So based on my palpation, the client didn't complain for any tenderness or pain. No swelling observed, and the temperature is very much normal. Next procedure we have is we need to assess or palpate the epitrochlear lymph nodes of our patient. Ma'am, I'm going to touch you. Is it okay? Okay. See the epitrochlear lymph nodes. Okay, it's not palpable. Is there any pain, ma'am, as I touch you? Is there any pain?
No.
Okay, the epitrochlear is not palpable. Okay, so based on my palpation, the epitrochlear lymph nodes is not palpable, and my client didn't complain for any tenderness or pain. Next procedure is to test for the range of motion of the shoulder, arms, elbows, and the elbows. Okay, ma'am, I want you to stand up for me. Okay. Let's have first the forward flexion. Okay. Hyperextension. Okay, very good. Abduction. Adduction. Let's have the external rotation. Internal rotation. Okay, very good. Sit down, ma'am. Alright, so based on the performance of my client, he didn't complain for any pain as he performed the procedure, and he can execute well the procedure, and there's no indication for muscle pain, muscle weakness, calcified and tendinitis, and atrophy. Next procedure is we need to palpate the brachial pulse, ulnar, and the radial pulse. Mom, I'm going to touch you. Is it okay? Alright. Let's see your radial pulse. Okay, it is strong. Your ulnar. It's not palpable. Your brachial pulse. Okay, great. The other one, please. Alright. So based on my palpation, the pulse is palpable. And it is strong, which is very normal. The rhythm is and no any indication for abnormalities. Next is we are going to test the range of motion of the wrist. Okay? Okay, ma'am, I want you to perform extension, flexion, extension, flexion. Very good. The other one, ulnar deviation, radial, ulnar, radial. Very good. So the clients tolerate the test without extreme pain. Therefore, my client's body are in good state. No indication of rheumatoid arthritis. Next is we need to inspect the palm of the hands and the fingers. Okay, we need to note the size, shape, symmetry, swelling, and the color. Alright, ma'am, I'm going to inspect your palm. Is it okay?
Okay.
Alright, let's see for color, swelling. Okay. Alright. Okay. So, based on my inspection, the hands and fingers are symmetric, non-tender, and without nodules. Okay? The fingers lie in a straight line, no swelling or deformity, no indication of Hervidin nodes and Bocard nodes, and also rheumatoid arthritis. Next procedure is we need to test the range of motion of the fingers. Okay? I want you to follow my direction. Is it okay? Alright. So I want you to abduction, adduction, abduction, adduction. Very good. Okay. Let's now perform hypertension, flexion, hyperextension, flexion. Very good. The other one, I want you to move your thumb to your finger. Move. Okay. Alright. Alright. Okay. Now, I want you to move your thumb to the base of the finger. Okay. Another one. Okay. Alright. So, based on the performance of my client, she can tolerate the procedure without any pain. No indication of the poitrine contracture and tenosynovitis. Procedure is we are going to assess the bicep, tricep, and brachioradialis reflexes of my client. Okay, so we are going to use a alternative neuro hammer or reflex hammer. Since I can't afford to buy the neuro hammer, as a nurse, we are taught to become resourceful. That's what I am doing right now, being resourceful. Okay. Alright, ma'am, I'm going to touch you. Is it okay? Alright. Let's have first your brachioradialis. Alright, is there any pain? Your bicep. Alright. Your tricep muscle. Is there any pain? Alright. So based on the performance of my client, the elbow flexes of the bicep and tricep muscle, which is it is seen. Okay? It ranges from 1 positive to 3 positive. In brachioradialis, there is a normal flexion and supination of forearm. No indication of abnormalities. Next is we are going to test alternating movement of the hands. Okay? In this procedure, we are going to ask our client to touch each finger using her thumbs. Okay, ma'am? I want you to touch each of your finger using your thumbs. Okay? Just the other one only. Alright? Okay. Okay, the other one. Very good. The other one, please. Okay. Alright, so very good. So my client can perform well in the test and no abnormalities observed. Next procedure is we are going to bilateral sensation. Okay? In this procedure, we are going to ask our client to close her eyes. Okay? First thing we need to do in this procedure is we need to assess the light touch and pain sensation in scattered location over the hands and arms. If light touch and pain are not intact, we are going to test for temperature sensation. Mom, I'm going to touch you. Is it okay?
Okay.
I'm going to perform the light touch. I want you to close your eyes. Did you feel it?
Yes.
Which part of your hands?
Right. Left.
Alright. Next is I'm going to perform the dull sensation using the paper clip. Did you feel it, ma'am?
Yes.
Which part of your hands?
Right.
Okay, very good. Next is we are going to assess did you feel it, ma'am?
Yes.
Which part of your hands?
Left.
Alright. So my patient or clients correctly identify light touch and correctly differentiate between dull and sharp sensation. No indication of anesthesia and high-pace anesthesia. Okay. Next procedure is we are going to assess fine motor function, which is the rapid alternatives movements. Okay. In this procedure, we are going to ask the client to put the palms of both hands down on her legs. Okay. Then turn the palms up and turn the palms down again. Okay. Ask the client to increase the speed. Like this one, ma'am. I want you to perform that one, and I want you to move that one as fast as you can. Okay. Okay. Start.
Okay.
Move as fast as you can. Alright. Okay, ma'am. Very good. So, my client rapidly turns palm up and down. No uncoordinated movement observed. Next procedure is we are going to test for stereognosis. Okay? In this procedure, we are going to ask our client to identify object that we are going to put or place on his on her palm. Okay? Ma'am, I want you to identify or project this object that I'm going to put on your palm. Okay? I want you to close your eyes. Right?
Okay.
Okay. Close your eyes. What object is this?
Scissor.
Okay. How about this one?
Coins.
Okay, very good. This one.
Cotton buds.
Alright. So, my client can identify and recognize object without hesitation. Okay? Next procedure is we are going to assess the Graphesthesia by writing a number in the palm of the client's hands. Okay? Alright. Ma'am, I'm going to wrote a number in your palm and tell me if what I project, okay?
Yes.
Alright.
Number 4 in my left. 5.
Alright, very good. Another one.
Number 4.
Okay, very good. So my client can project or visualize number that I wrote on her palm. No indication of abnormalities. Next procedure we have is we need to inspect the lower extremities for overall skin coloration, texture, moisture, masses, lesion, and varicosities. Okay? Ma'am, I'm going to inspect your lower extremities. Is it okay?
Okay.
Your legs, okay? Alright. Let's see if there is any varicose veins. Okay. The other side. Okay. So everything is normal in my client's lower extremities. The skin color has no indication of cyanosis, pallor, or jaundice. Okay. I haven't observed swelling or redness, and it has a soft texture and no masses and lesion observed. Okay. No presence of varicose veins. Next procedure is we are going to palpate the muscles of the legs and feet, okay? We are going to note for masses or bulging area and tenderness. Ma'am, I'm going to touch you. Is it okay?
Okay.
Alright. Okay, your muscles, if there is any bulging masses. Okay, your glottis maximus and minimus. Okay. No masses or bulging area. Alright, so based on my palpation, my clients didn't complain for any tenderness or pain. No bulging area or masses is observed. Okay? Next procedure is we are going to note hair distribution or inspect the hair distribution. Okay? Ma'am, I'm going to touch you. Is it okay?
Okay.
I'm going to see or look or inspect the hair distribution on your leg. Okay, they're slightly visible. How about the other one? Okay, they are both symmetrical. Alright, so the hair on the legs are slightly visible, which is very much normal in our female client. It is evenly distributed and symmetrical in both legs. Next procedure we have is we need to palpate the joint of the hips and test for the range of motion, okay? Ma'am, I'm going to touch you. Is it okay?
Okay.
I'm going to palpate the joint of your hips. Is there any pain as I touch you?
No.
Okay. How about that one?
No.
So, okay, let's start on performing the range of motion, okay? Let's have first the hip flexion with knee straight. Okay, can you raise this one? No? Okay. Very good. The other one, hip flexion with knee bend. Raise this one. Alright. Raise. The other one, please. Very good. So now let's perform abduction. Abduction. Adduction. Abduction. Adduction. Okay, so let's move to external rotation. External rotation, ma'am. Internal rotation. External rotation. The other one, please. Internal rotation. External rotation. Internal. Okay, very good. Now let's perform the hyper extension. Okay. Okay, very good. The other one, please. Okay, very good. Thank you. Alright. So, my client can tolerate the test without extreme pain. Therefore, my client's body are in good state. No indication of hip disease. Next procedure we have is we need to palpate for edema and palpate the nails, including the popliteal pulse. Okay? Ma'am, I'm going to touch you. Is it okay?
Okay.
Let's say if you have an edema. Okay. None. Alright. So, let's palpate your popliteal pulse. Okay, the other side. Alright. So, based on my palpation, no indication of edema in the popliteal pulse is strong and regular in terms to its rhythm. Next procedure we have is we need to palpate the ankles and assess the dorsalis pedis and posterior tibial pulses bilaterally. Okay? After that, we need to test the range of motion. Okay? Mom, I'm going to touch you. Is it okay?
Okay.
Alright. Let's see. Okay. The other one. Okay. Alright, very good. So now let's move to the range of motion, the test for range of motion, okay? Mom, I want you to perform dorsiflexion, plantar flexion, another one, dorsiflexion, plantar flexion, the other side, the other legs, feet, dorsiflexion, plantar flexion, okay, very good. Alright, let's move to inversion, eversion, inversion, eversion, very good. Let's move to the abduction, adduction, abduction, okay, that's great. Alright, so based on the palpation, as I palpate the dorsalis pedis and the posterior tibial pulse, it is absolutely strong and the rhythm is regular. The clients can tolerate the test without extreme pain or tenderness. Everything is fine and normal. Next procedure we have is we need to assess capillary refill, okay? Mom, I'm going to touch you. Is it okay?
Okay.
Alright, can I see your nails? Okay. Okay. The other one. Okay, the other one. Can I see your hands, please? Okay, the other one. Okay. So, based on my assessment, client's capillary refill suggests no abnormalities observed. Okay. So, we all know that capillary refill test is used to monitor the hydration and the amount of blood flow to the peripheral tissue. Okay. Next procedure is we need to test for dull and sharp sensation using the paper clip. Okay, Mom, I want you to close your eyes. Did you feel it?
Yes.
Which part of your legs?
Left.
Alright. How about this one? Did you feel it?
Yes.
Which part of your legs?
Right.
Okay, very good. So my clients correctly differentiate between dull and sharp sensation. No indication of anesthesia and hypesthesia. Next procedure is we need to perform heel to shin test, okay? Alright, Mom, I want you to perform like this one. Okay? Very good. The other one, please. The other one, please. Okay, the other one. Alright, very good. So, my patient is able to flex her hips to place the heel to the knee and help to run smoothly down the twist of the tibial to the ankle. Everything is normal and fine. So, you have nothing to be worried about it, Mom. Next procedure we have is we need to assess the patellar, Achilles, and the plantar reflexes. Mom, I'm going to touch you. Is it okay?
Okay.
Okay, I am going to use my alternative neuro hammer. Okay? Let's have first the patellar. Is there any pain as I touch you?
Yes.
Is there any reflexes?
Okay.
Alright. Achilles. Is there any pain?
No.
Alright. Is there any response?
Oh.
Alright. Let's have first your plantar. Is there any response?
Yes.
Alright. So, on the patellar reflex test, the knee extend, quadricep muscle contract, okay? Ranges from 1 positive to 3 positive. For the Achilles reflex test, the normal response is plantar flexion of the foot. Ranges from 1 positive to 3 positive. And lastly, for the plantar reflex test, flexion of the toes occurs and no abnormalities observed. Next procedure is we are going to perform the manual compression test, okay? Ma'am, I'm going to touch you, is it okay? Tell me if there is any pain as I touch you, okay? Alright. Put your... Okay. Is there any pain, ma'am?
No.
Okay, the other one, please. Is there any pain?
No.
Very good. Okay, so no pulsation is palpated if the client has competent valves, no indication of fracture. Next procedure is we are going to perform the bulge knee test, okay? Mom, I'm going to touch you. Is it okay?
Okay.
Alright. Okay. Can you put your... Alright. Is there any pain?
No.
There's no bulging masses. The other one, please. Okay, no bulging masses. Alright. So, no bulge of fluid appears in front and the medial side of the knee, okay? Next procedure is we are going to perform the ballotment test, okay? Mom, I'm going to touch you again. Is it okay?
Okay.
Alright. Can you put your... Okay. Is there any pain as I touch you?
No.
Okay. The other one, please. Is there any pain as I touch you? Alright. So, no movement of the patella is noted. The patella rests firmly over the